Having an Aboriginal workforce is really important to the delivery of healthcare and to be leading research. You know, obviously there's a lot of historical factors that have contributed to Aboriginal people's experiences and having a lack of trust of systems, and particularly, you know, research hasn't had a good history with our people, and so therefore us leading the work, there's more of a level of trust and that we do things our way and the right way. So we have the South Australian Aboriginal Health Research Accord, which guides the work and the way that we do our work. We have elders involved in our work. We have community reference groups that provide guidance and interpretation to the data that we're collecting, the co-design about how we're going to go about doing the work, the types of questions that are important to community, and then how we actually implement that is really critical. And obviously having an Aboriginal workforce also helps to build those connections with community, and informs the way of doing our business from a cultural perspective, which is critical to the work that we do, and that's what makes us unique. Aboriginal people have a unique experience. They bring a lived experience to the work that you can't get without having community involved. And so building those relationships, having our elders around the table, having other leaders with us, that's really a rewarding experience. If you're interested in, STEM and science and opportunities, there's many opportunities to work in health and medical research. And, it's a place for Aboriginal and Torres Strait Islander people as well. But, that we have a presence here and that we have a rightful place to be health and medical researchers. And, really the world is your oyster depending on what your interests are. And we can enable that through an organisation like SAMRI.